Hello everyone. Today we are going to see about gateways to the lower limb. Okay, gateways. What does it mean? It is the way or route by which structures passing from one to the other. Okay, the structures may be artery, veins, nerves, or maybe muscles also. Okay, in lower limb we have four routes by which structures passing from the abdomen and pelvis into and out of the lower limb. Okay, what does it mean into and out of the lower limb? Into means which enters the lower limb. Out means which leaves the lower limb. Okay. If you consider artery, it enters the lower limb from the abdomen. When you consider vein, it leaves the lower limb and enter into the abdomen. Okay. The four routes are greater sciatic foramen, lesser sciatic foramen, obturator canal, and gap between the inguinal ligament and the anterior superior margin of the pelvis. Okay, we already know that greater sciatic foramen, lesser sciatic foramen, obturator canal, and the inguinal ligament. Okay, in this structure, you can see this is the greater sciatic foramen, lesser sciatic foramen, and this is obturator canal, and this is the gap between the inguinal ligament and the pelvic bone. Okay, we know that inguinal ligament is attached laterally to the anterior superior iliac spine and medially to the pubic tubercle. Okay, below this only we have that gap. Okay, we move to obturator canal. Obturator canal, first of all you want to know that obturator foramen. Okay, obturator foramen is formed by this is inferior ramus and the superior ramus and the adjacent bones. This is the obturator foramen. This obturator foramen is fully covered by the obturator membrane. Okay, obturator membrane. In the upper margin of the obturator membrane we have some gap. This is the gap. This gap is the obturator canal. Okay, obturator canal. Upper margin of the obturator membrane we have some gap. This is the obturator canal. Okay, and the inferior surface of the superior ramus. We have one groove called the obturator groove, through which obturator artery, vein, and a nerve come out of the abdomen and enter into the lower limb, that is a medial compartment of the lower limb or thigh. Okay, and then this is a greater sciatic foramen. This greater sciatic notch is converted into greater sciatic foramen by the attachment of the sacrospinous ligament, and the lesser sciatic notch is converted into the lesser sciatic foramen by the attachment of the sacrotuberous ligament. Why we called it a sacrospinous and sacrotuberous ligament? Because sacrospinous ligament is originated from the lateral surface of the sacrum. This is sacrum, lateral surface of the sacrum, and inserted in the ischial spine. So we called it as sacrospinous. And the sacrotuberous ligament is inserted to the ischial tuberosity. Okay, so we called it as sacrotuberous ligament. Okay. This gap between the inguinal ligament and pelvic bone connects the abdomen to the anterior compartment of the thigh, and this obturator canal connects the abdominopelvic cavity to the medial compartment of the thigh, and this greater sciatic foramen connects the pelvic cavity to the gluteal region that is in the posterolateral aspect. Okay, and then this lesser sciatic foramen connects the pelvic cavity to the gluteal region, that is also in the posterolateral aspect. Okay, that's all about this. We move to next. This is the posterior aspect. Okay, this is sacrotuberous ligament and this is sacrospinous ligament. This is a greater sciatic foramen. This is lesser sciatic foramen. Okay, In this slide you can see one muscle coming out of the pelvic cavity and enter into the gluteal region. This muscle is the piriformis muscle. Piriformis muscle. Okay, piriformis muscle, which originated from the anterolateral aspect of the sacrum and inserted into the upper margin of the greater trochanter. Okay, and this muscle separate the greater sciatic foramen into two parts, a part above this muscle and a part below this muscle. Okay, through this gap nerves and vessels enter and supply the gluteal region, or suddenly immediately enter into the lesser sciatic foramen and supply the perineum region also. Okay, in this picture you can see a nerve and the vessels coming out of the pelvic cavity and enter into the gluteal region, a part above this muscle. Okay, a part below this muscle, a structures passing out of the pelvic cavity and enter the gluteal region, and some vessels and nerves coming out of the gluteal region, pelvic cavity through the greater sciatic foramen and immediately enter into the lesser sciatic foramen and supplies the perineum region also. Okay, in that you can see this green structure is the sciatic nerve. This is very important, which is this nerve which is supply the posterior compartment of the thigh and posterior compartment of the leg and anterior compartment of the leg and foot also. Okay, very important nerve. This is the largest nerve in the body. And this is a posterior cutaneous nerve, and this is pudendal nerve, which coming out of the pelvic cavity through the greater sciatic foramen and immediately enters into the lesser sciatic foramen and supplies the perineum region. Okay, and this is inferior gluteal nerve. This is inferior gluteal vessels, and this is superior gluteal vessels and superior gluteal nerve. Okay, we move to obturator canal. First of all, we enter into obturator canal. We should know about the obturator foramen and obturator membrane. Okay, obturator foramen, I already told that obturator foramen is formed by the inferior ramus and the superior ramus and the adjacent bones of the pelvic bone. Okay, this is the obturator foramen, and the obturator foramen is covered by the obturator membrane. Okay, obturator membrane. In the upper margin of the obturator membrane and between the superior ramus, we have one gap called the obturator canal, through which obturator artery and nerves and veins come out of the abdominal pelvic cavity and enter into the medial compartment of the thigh, that is the adductor compartment of the thigh. Okay, that's all about the obturator canal. Okay, we move to greater sciatic foramen. Greater sciatic foramen is formed from the greater sciatic notch and the sacrospinous ligament. Okay, through this greater sciatic foramen, one muscle is coming out of the pelvic cavity and enter into the gluteal region, that is the piriformis muscle. Piriformis muscle, which separate the greater sciatic foramen into two parts, a part above the piriformis muscle and a part below the piriformis muscle. Okay, above piriformis muscle, some nerves and vessels coming out, and below the piriformis muscle, some nerves and vessels coming out. What are they? We will know that. Okay, above piriformis muscle, superior gluteal nerve, and then superior gluteal artery and superior gluteal vein, which supplies the um, which supplies the gluteus minimus and the gluteus medius. Okay, and below piriformis muscle, sciatic nerve, inferior gluteal nerve, inferior gluteal artery, inferior gluteal vein, pudendal nerve, posterior femoral cutaneous nerve, nerve to obturator internus and nerve to quadratus femoris. These are the structures which coming out of the pelvic cavity and enter into the gluteal region through the greater sciatic foramen below piriformis muscle. Okay. Uh, you want to know the structures. This is very important. They ask in 2 more questions. Okay. Sciatic nerve is the largest nerve in the body, and the inferior gluteal nerve supplies the gluteus maximus. Okay, gluteus maximus. And superior gluteal nerve also supplies the tensor fasciality. Okay, which is attached to the thickened fascia in the lateral side, that is iliotibial tract. Okay, and then pudendal nerve which come out a greater sciatic foramen and immediately enter into the lesser sciatic foramen and supplies the perineum region. Okay, posterior cutaneous nerve which supplies the posterior compartment of the thigh skin. Okay, nerve to obturator internus which supplies the obturator internus muscle and the superior gamellae. Okay, superior gamellae muscle. And nerve to quadratus femoris supplies the quadratus femoris muscle and the inferior gamellae muscles. These are the muscles in the gluteal region. When you study about the gluteal region, you can understand it. Okay. And then lesser sciatic foramen. Lesser sciatic foramen formed by the lesser sciatic notch and the sacrotuberous ligament. That is a lesser sciatic notch is converted into lesser sciatic foramen by the attachment of the sacrotuberous ligament. Okay. We already know that greater sciatic foramen greater sciatic foramenல இருந்து வர மசில் வந்து பைரிஃபார்மிஸ் மசில். அதே மாதிரி தான் லெஸ்ஸர் sciatic foramenல இருந்து வர மசில் வந்து என்னென்னா obturator internus muscle. That is obturator internus muscles passing through the lesser sciatic foramen from the எங்கேருந்து வருது அப்படின்னா from the perineum region and enter into the gluteal region. Okay, enter into the gluteal region and it inserted in the actually it is originated from the inner surface of the obturator membrane. Okay, inner surface of the obturator membrane originated from the inner surface of the obturator membrane and it pass out of the pelvic cavity through the lesser sciatic foramen and enter the gluteal region and inserted into the medial surface of the greater trochanter. Okay, and this pudendal nerve to obturator internus, inferior pudendal artery and vein pass into the perineum from the gluteal region. Okay, pudendal nerve, obturator internus and then inferior pudendal artery and vein, inferior pudendal vein. This all come out of the pelvic cavity through the greater sciatic foramen and immediately enter into the lesser sciatic foramen and supplies the perineum region. Okay, that's all about the lesser sciatic foramen. Okay, gap between the inguinal ligament and the anterior superior margin of the pelvis. Through this gap, femoral nerve, femoral artery, vein, femoral vein, psoas major muscle, iliacus and then pectinus muscles all coming out of the abdominal cavity and enter into the anterior compartment of the thigh. And then lymphatics also. lymphatics, femoral branch of genitofemoral nerve, lateral cutaneous nerve of thigh, all coming out of the abdominal cavity and enter into the anterior compartment of the thigh. Okay, only exception is the femoral vein, which coming out of the lower limb and enter into the abdominal cavity. Okay, this is the femoral nerve which supplies the anterior compartment of the thigh, that is sartorius muscle, rectus femoris. இதெல்லாம் வந்து நீங்கள் மசில்ஸ் படிக்கும்போது படிப்பீங்க. இது femoral artery. Femoral artery is the most of the lower limb is supplied by the femoral artery, and the femoral vein also like that. Psoas major, which is originated from the posterior abdominal wall and inserted in the lesser trochanter. Iliacus also originated from the iliac fossa, that is in the hip bone la paathirupom. Iliac fossa, that is originated from the iliac fossa and inserted in the lesser trochanter. So both psoas major muscle and iliacus muscles have the common tendon, so we called it as iliopsoas in the lower limb. Okay, iliopsoas muscle. And then pectineus muscle, okay, which is originated from the pectineal line in the pubic bone and then inserted into the pectineal line of lesser trochanter, that is the line below the lesser trochanter. And lymphatics, and then femoral branch of genitofemoral nerve. This femoral branch of genitofemoral nerve from the lumbar flexus, okay, and lateral cutaneous nerve of thigh is also from the lumbar plexus and supplies the lateral side of the skin of the thigh. That's all about this. Okay, if you have any doubt, you ask in the comment box, and like and share and subscribe this video. Okay, thank you everyone.